Polyhydramnios, Evaluation and Management. This lecture is based on and lung fluid and versus resorption of the bucket or by subjective assessments in various guidelines. And when there is polyhydramnios, that is discussed later. And another rare condition of congenital resulting in increased vascularity and hyperdynamic circulation result peristalsis as shown here in the video, and the differential diagnosis is ileolysis, or it may be due to GI swallowing, may also be due to intraoral mass. Example of a goiter which is seen both in axial and sagittal scan. This appearance in all the three images suggestive of the limbs. You see very scarce soft tissue veins results in hydrops and polyhydramnios. We see, and in both the axial and coronal scan, there is persistently non-visualized that determines the level of obstruction, whether it is jejunal or ileal. There is polyhydramnios. So there must be some other cause also associated with PAM, certainly not in every case. So when you are not able to detect age, a cause was identified to diagnose this and again seen. So with this you don't exclude and in the axial scan of the neck you don't see the uvula. In coronal scan on ultrasound you get polyhydramnios, and otherwise then tracheal agenesis, so which is a very rarely originate individually from the distal part of the esophagus as shown in the because of these very obvious anomalies, these conditions are diagnosed and readily diagnosed, and then SVC and the trachea. So trachea is seen, and you see the images of the 3V for the esophageal pouch, which will pop up between the spine and the trachea when there is esophageal at coronal scan of the trachea in cases of polyhydramnios. So when in tracheal agenesis, the trachea will be absent. Methacin should not be used for the sole purpose of decreasing amniotic fluid. Tertiary center. Thank you for your patient listening. Having gone through the preview, if you wish to listen to the main lecture video, go to sonoshare.in.